So I'm going to talk about complications of giving activated charcoal to someone in the context of overdose. There's been a whole bunch of case reports, some of them quite dramatic, about things that could go wrong when you give someone charcoal. The worst of them are always the ones where someone's put an NG tube down the wrong path into the lungs and given charcoal into the lung instead of into the stomach. And really, you can class the complications into respiratory and GI. And with the respiratory, the main complication that people think about is aspiration pneumonitis. And with the GI side effects, you can get obstruction and you can get bezoar formation. But actually, all of these complications are quite rare. And overall, charcoal is a safe treatment to give to people. So there was a guy called Arnold who basically was trying to answer the question of whether charcoal is particularly bad to aspirate compared to other stuff. And he used a rat model. So he took some rats and isolated rat lungs, so they were outside of the rat, just kind of perfused. And then he instilled into these lungs either charcoal or distilled water. And then he basically saw what happened, looked at the lungs under a microscope and proved that it is worse to aspirate charcoal than water. But it's not really clear if that's a helpful result because no one really aspirates distilled water, and it's not a very good comparison when we're thinking about real people that have overdosed. It would have been great if he had instilled gastric contents with or without charcoal, but that's not how he did the study. So Jeff Isbister did a good review of about 4,500 cases that had come in with overdoses. And then he ran a statistical regression to see who got aspiration pneumonitis and what predicted it. And he found a bunch of factors that did predict aspiration. So one was age, another one was decreased level of consciousness, one was seizures, another one was a delay to the time of presentation. Tricyclic antidepressant overdoses were particularly risky for aspiration pneumonitis. Vomiting, that's a kind of self-explanatory one because obviously if you vomit lots, you're more likely to aspirate your vomit. But actually charcoal was not a predictive factor of aspiration. So that, I think, is quite reassuring to have looked at all those thousands of patients and not found that people who get given charcoal are particularly more likely to aspirate than people who don't. I think that there is just a baseline level of just under 1% of overdose patients will aspirate regardless of whether they get charcoal or not.